Hi, folks. It's Marvin Music with MedicareSchool.com, and we want to thank you for joining in tonight. It is 5 o'clock. I am actually standing in our studio that is in Overland Park, Kansas, which is a suburb of Kansas City, Missouri. And I want to let you know that I just got in this morning at 2:30 from a 2-week mission trip in India. Some of you probably know this, but I used to be a pastor for 20 years, and I've stayed very well connected to a great friend of mine who's a national pastor in India. And so I go over every year and do pastors' conferences for him and travel around and speak at different churches. So just got back, and great trip. Love to go over there. But it's great to live in our country. India's a wonderful place to visit, but I would not want to live there. But we are glad you're here. Tonight we have selected a topic that I hope will be helpful for you as we look at some of the changes that are going to occur in 2025. I'm going to go through those. And then also tonight, I'll be answering your questions. And so if you would like, you can start putting the questions in the chat. And then once I've shared our topic and speak about that for a few minutes, then I'll answer those questions. And feel free to answer any questions that you have about Medicare, anything about Social Security as well. And so we can deal with all those. And then if you don't mind, just before I get started, we'd love to know where you're tuning in from. In other words, your city and state. So it's always nice to know who's in our audience tonight. All right, so tonight what we're going to do is we're going to talk about the changes for 2025. Again, I'll mention a few things about Social Security as well. But first off, as we look at the Medicare changes, I always like to go through what we call the gaps in Medicare. And these are gaps meaning that if you stay in the original traditional Medicare system, which means you have A and B and typically get a supplemental plan, then the gaps are the things that your supplemental plan is going to cover. And there's actually 6 different gaps. There's 3 gaps on the A and there's 3 gaps on the B. And actually 4 of those gaps changed for this year. And so the A deductible for 2025 is $1,676. $1,676, and that just simply means if you go to the hospital, you're going to be responsible to meet that deductible, and that's your full out-of-pocket expense for up to 60 days in the hospital. So it doesn't matter whether you're in the hospital 1 day or 2 days or 10 days, all the way up to 60, your out-of-pocket expense is $1,676. Now, the A deductible is unique to Medicare because it's not an annual deductible. It's called the benefit period deductible, and that means that you would owe this deductible, and then if you're ever in the hospital, you pay the deductible, and then once you're discharged, if you are readmitted within 60 days of being discharged, that same deductible still applies. Why? Because you're in that same benefit period. But if you're hospitalized and then discharged and 60 days goes by and you're not re-hospitalized, but something were to happen to you after that 60 days of being discharged, you go back to the hospital, then you would owe that deductible again. That's called a benefit period, so $1,676. And that's going to cover most situations in the hospital, but occasionally people are in longer than 60 days. And so what Medicare does is after 60 consecutive days in the hospital, now you're responsible for daily copays, and those change as well. And so this means month 3, if you're still in the hospital, your copay is $419. That's the 3rd month, and then month 4 and month 5, they double that, so it's going to be $838. Those are called extended hospital stays. Again, they're rare, but I want to be sure at least you knew those are the numbers for next year. Now, the other thing that changed on the A side of Medicare would be the skilled nursing facility copay. And so the way Medicare works is as long as you've been in the hospital for at least 3 days or longer, when you go to the skilled nursing facility, Medicare doesn't charge you anything for the first 20 days. They cover everything. After 20 days, if you're still in the skilled nursing facility, you have to pay a daily copay. And again, that changed for next year, and that's going to be $209.50 a day. And the average right now is about 35 to 40 days in a skilled nursing facility. So the first 20 Medicare covers. After that, you would pay that daily copay, $209.50. And then on the B side of Medicare, only one thing changed, and that's the B deductible. The deductible this year is $240. It's moving to $257. That's the B deductible. And the B deductible is a calendar year deductible. So if you start Medicare in January, then that's your deductible for the whole year, $257. If you start Medicare in July, your deductible is still the same. They don't prorate the B deductible. But again, it's not like the A deductible. It only happens once a calendar year, and then it resets every every January. The co-insurance is still 20%, and excess charges, if and when they occur, are still the additional 15%. Those did not change. All right, so those are your gaps for 2025. And then I also want to talk about, before I get too far into the topic, as we talked about that one gap of excess. Excess charges means that's when you see a doctor that adds to the bill, and they can legally add 15%. It is very rare when that happens, but I just want to make sure that you know that that is really the main difference between your supplemental plans G and N. The G plan covers the excess charge, the N does not. Now, again, the likelihood of it occurring is pretty small, but if it did occur and you had an N plan, then you would be responsible for excess charges. And then the N plan also has a copay to go to the doctor of $20 and then emergency room copay of $50. So I mention that because most people today that are going on traditional Medicare and getting a supplemental plan are getting either a G or an N. And honestly, they're both very good decisions. I don't think you're making a mistake either way. Some people are looking for the most comprehensive coverage, and they're fine to pay a little extra for that comprehensive coverage. Then they are going to typically get a G plan. Those that would like to save maybe $30, $40 a month or more may take on the additional risk of excess and some small copays to go to the doctor, but they're going to save that premium on the N plan. So again, both are fine. You just have to decide what you're going to be most comfortable with. All right, so that's the changes there. And then let's talk about the Part D plans. This is probably the largest changes that are occurring within Medicare for 2025 has to do with Part D plans. One big change, there's not near as many companies offering the plans. That's been cut down drastically. Still options, but not near as many. And so what is happening this year is Medicare has eliminated the donut hole. It was called the coverage gap. That was the stage 3 of all drug plans. That is now gone in 2025. We never have to deal with that again, and we're all glad for that. And so in 2025, we actually have 3 stages or phases of your drug plan. And the phase just simply means that that's your out-of-pocket expense, and it is going to change depending upon the phase you're in. And so the first phase is the deductible phase. And that this year is $545. It's going to $590 for your Medicare Part D deductible. The majority of plans are going to have a deductible. Some reduced it a little bit. Some took all the way down to zero. And so if you do have a deductible, the most it could ever be is $590. And that just simply means that the first $590 of medication costs is going to be out of your pocket. And then once you've satisfied the deductible, then you would go to phase 2. Now, I want to clarify something. When you're on a drug plan, there are some prescription that you take that could be deductible exempt. In other words, you would just pay maybe a $2 copay or a $4 copay or a $0 copay, and so that's those drugs don't even apply to the deductible. And the reason I share that with you is because many people will never even reach their deductible because their medications are very low. And by the way, that's a fine thing. We're glad you don't reach the deductible. And so if your meds are low, you'll never reach the deductible, so you will stay in phase 1 the whole year of 2025. Now, if you're on a lot of meds or maybe on expensive meds, then you'll probably reach your deductible early on. And once you've reached your deductible, then you go to phase 2, which officially by Medicare is called the I'm blanking on that initial coverage. Sorry about that. Remember, I've been in India 2 weeks, so the initial coverage phase. And in the initial coverage phase, what you have are some co-payments. You just pay a co-payment, usually somewhere between about 10 to 25% of the cost of the medication, and that's your co-pay responsibility. And then the Part D plan pays the rest. But what has happened now in 2025 in this phase 2 initial coverage phase, the maximum out of your pocket would be $2,000. You could be on a medication that costs $15,000 a month or $10,000 a month. It doesn't matter. The most you'll spend in all of 2025 out of your pocket is $2,000, because now we have a spending cap on prescription drugs. So again, the max is $2,000. And then if you ever reach that $2,000, then you go to what is called the catastrophic phase. And that means that you've reached the cap, and now all your meds are covered at zero out of your own pocket. The plan will pay the rest, Medicare pays some, as well as the manufacturer provides some discount. So that's a huge change for 2025, max out of pocket. Now, I do want to clarify one other thing. Sometimes people, even though they're happy that 2,000 has a cap, sometimes people can't meet that out of pocket very quickly. And so the government started a new plan this year. It's called the Medicare Pharmacy Payment Plan, Prescription Payment Plan, brand new. And this is for people that may find it difficult to come out of pocket that $2,000. So what you can do, you can actually make payments on that $2,000 and they'll be spread out throughout the year. But you do have to enroll into that plan. Now, if your meds are cheap and you're only going to come close to reaching the $2,000, I would not enroll in that plan. But if your meds are expensive, then probably a pretty good idea to enroll in the plan. And so what changes is this. You have to pay a premium for your plan, but you no longer pay for your prescriptions at the pharmacy. You just pay your plan, you pick up your prescriptions, and then the plan itself actually will bill you for your prescriptions. And so that's called the Medicare Prescription Payment Plan. And I would recommend enrolling in that if you're going to reach that $2,000 cap. It could kind of smooth that out throughout the year. All right, then the other thing I want to mention has to do with your Part B premium. We know that the Part B premium went to 100, Daniel, help me, 185 even. Okay, I thought so. Boy, I'm kind of, yeah, jet lag, there we go. 185 a month, and it was this year it's 174.70, but it goes to 185. And so it went up $10.30 a month, and so if you're on Social Security, that Part B premium is going to come out of your Social Security check. If you're not, then the government will continue either to bill you quarterly, or you can set up a payment plan with them called Medicare Easy Pay. And so pay quarterly or do a bank draft, or it comes out of your Social Security check. Now keep in mind, if you're on Social Security, it has to come out of your check, but otherwise they'll give you a couple other payment options. And here's why that matters. We call that the base of the standard premium. And so our Part B premiums are based upon our modified adjusted gross income. And so that income decides how much we pay for Part B. And again, those numbers are also changing for 2025. And what the government does is they actually set a threshold. And so the threshold number or below that threshold, then you would pay the base premium. Again, $185 a month. And so those thresholds for a single filer for 2025 will be $106,000 modified adjusted gross income 2 years prior. So we're starting Medicare in 2025. They're going to look back at 2023. And so if you're a couple, that threshold is going to be $212,000 or below. Then you'll pay again the $185 each. And so when they look back 2 years, they're doing that because sometimes people file extensions on their tax returns, and so they always look back 2 years. And so whatever your modified adjusted gross income was 2 years ago will determine what you're going to pay for this year's Part B premium. So what happens is we set the threshold. So again, single below 106, a couple below 212,000. If we're going to be above that, then we're going to have an additional surcharge called an IRMA, and it's an acronym that stands for Income-Related Monthly Adjustment Amounts. And so if you have a question about that tonight, we can discuss that. I did bring my IRMA chart with me so you would know what the new IRMAs are at certain levels. But basically we have 5 different levels, and we would look at these as like marginal tax brackets. So 5 different amounts of IRMAs ranging from about $85 a month upwards to about $500 a month if you're real high income. And so again, that is going to be a change for the next year. And then lastly, I do want to mention that if you're on Social Security, of course, we know we got a 2.5%, whether it was 2.3% cost of living adjustment. So obviously, you're going to see that come out in your check for 2025. All right. And so if you continue to work, the government is still going to have an earnings test, because remember, if you are taking Social Security prior to your full retirement age, you can only make so much money for working wages. They call that an earnings test. And so just be mindful of that. Now, once we get to full retirement age, we're not subject to an earnings test. You can make as much money as you want, and there's no impact at all on your Social Security check. All right, and so those are the things we want to cover. And so what I'm going to do now is take questions, anything that you're curious about. We'll try to take as many of those as we can tonight. Okay, Daniel. All right, do you recommend an Advantage plan? Well, Karen, there are some times when an Advantage plan is a good choice. Whenever people cannot afford a premium for a supplemental plan, then I think an Advantage plan is a good option. However, if people can't afford a little extra each month on a supplemental plan, I believe that long term they're going to be happier with that. And the reason for that is because to date, Advantage plans are still allowed to have what's called a pre-authorization. And so pre-authorization means that the doctor makes a recommendation, but the plan must agree with the doctor and approve what the doctor is recommending before you get that service. And some pre-authorizations are delayed, and sometimes they're flat denied. And that can be very troublesome for people when they're having some serious health issues. And so that's one reason I like supplemental plans, because we never deal with that. Supplemental plans follow Medicare. So if Medicare says we'll cover something and doctor says you need that, we don't have to worry about insurance approval at all. And so to me, that's a big deal. So I would rather pay a little extra to have a supplemental plan so I never have to deal with the pre-authorization. Second thing is, all Advantage plans are going to have a network. The majority of them are going to be an HMO network, which means we have fewer providers available to us. And so if someone goes through some serious health issues and they would like to see a certain oncologist, maybe they don't take the plan, then you can't go there. And so again, that's another negative with an Advantage plan. They always have networks, either HMOs or PPOs. And so there's restrictions. If I have a supplemental plan, I don't have to worry about it, because if that doctor takes traditional Medicare, they have to take your supplemental plan. Whatever company you choose, whatever plan you choose, they have to take that. So again, that's a really nice benefit. And then the third and last thing I'd mention, I could go on other items as well, but the other issue is this. If you take an Advantage plan and you stay on that Advantage plan for a year or 2, 3, 4, 5 years, and want to get off the Advantage plan in almost every state in the country, to get off of an Advantage and then move back to traditional Medicare and get a supplemental plan, you have to medically qualify to get that supplemental plan. So if your health is such that you can't qualify, now you're stuck in the Advantage system then for the rest of your life. And so that can be troublesome. Now, there are some states, New York, Connecticut, Vermont, Maine, and Massachusetts, where that doesn't apply. But all the other 45 states and the District of Columbia, again, if you want to get off Advantage and move to supplemental plan, you're going to have to go through medical underwriting. And so if your health is changed, you may not be able to do that. So those are just a couple of the reasons why I say supplemental plans are better than Advantage. However, if you cannot afford the premium or don't want to afford the premium for that supplemental plan, then by all means get an Advantage plan, preferably a PPO, so you'll have at least some better options than an HMO. All right, I need a hernia repair. What is the best plan to keep my costs low? Well, I would either do a G plan or an N plan, depending upon where you live. In the majority of states, the difference in premium between a G and an N are going to be about $40 a month. Some states it's more than that. And so again, I would compare both the G and the N plan to see what makes most sense for you on your monthly budget. Now, as far as out-of-pocket expense, what's going to happen on a hernia operation, it's going to be outpatient. And so you're going to be responsible for your B deductible. And again, the G or the N is the same on that. That's $257. And then after that, the G or N plan is going to cover all the expenses for that operation. Now, the difference between those two plans would be some of your doctor visits prior to the hernia operation. Your N plan, you're going to have a $20 copay. And if you happen to go to a doctor or a surgeon that charge excess, that N plan would not cover your excess. Again, that's probably pretty unlikely, but it still could happen. So the G or the N, I think, would be the very best way to go if I knew for sure I was going to need a hernia operation. Okay, how far in advance can CMS L564 be completed by employer and applying for parental? Okay, no sooner than 90 days. And so that's the perfect window of time. If you try to submit that L564 prior to that, they're not going to process it. In fact, most offices will not. But that 90-day window is fine, and 30 days is fine as well, 30 or 60 days. We feel like ideally 60 to 90 days is the very best time. All right, are there important reasons to enroll in Medicare in person versus online submitting, supporting? No, I don't think there's any benefit at all. In fact, I would not set up an in-house appointment if it were me. The only reason that has to happen sometimes is because if people don't have their own 40 quarters, they may find it easier to go to the Social Security office to work that through. But other than that, I would not. I would go online, have an SSA.gov account, and then you can enroll an A and B online. Much simpler, and there's no advantage whatsoever. Okay, Medicaid, I'll be 65. We'll see my Medicare card 100 days before I go on Medicare. Okay. Well, if you're on Social Security, then you'll be automatically enrolled into Medicare, and you will get your Medicare card 100 days before. But just because you're on Medicaid doesn't mean you're automatically going to be enrolled into Medicare. It's those that are on Social Security are automatically enrolled into Medicare. So you will get your card if you're on Social Security. And so what's going to happen, John, you'll need to check with Medicaid is you want to make sure that you're still eligible for the same Medicaid package as you are right now once you go on Medicare, because there are some states where that changes, and some states they actually make you reapply for Medicaid once you have Medicare. So just call your state Medicaid office and ask them, now that I'm turning 65, how is this going to affect my Medicaid eligibility? And they'll let you know. Okay, I stayed with supplemental plan in. What will be my monthly payment? Oh, I have no idea, Christine, depending on where you live. I will tell you this as far as payment increases, they happen differently with companies. Some companies take their price increases in the spring of the year, and some only take it once a year on your effective date. So if you had an effective date of, let's say, February 1, then that's probably when you'll see a price increase, and those companies normally notify you about 60 days prior to that price increase. So again, I wouldn't have no way of telling you that at all. And if you're a client, you can certainly call in, and if we're around that 60-day window, then we're happy to go online and see what those rates could possibly be, but the carrier will notify you for sure. How does Medicare A and B and an in-supplemental plan pay for in-home hospice care? Okay, what happens, hospice is actually a Medicare Part A benefit. It's not B. So anything that would be part of the hospice care, which is pain management and different services they provide, that is paid through A. And then your in plan would be picking up any other out-of-pocket expenses that you would be responsible for, which would be very little anyways, because that A is going to pay the majority of those hospice expenses. And so now let me tell you something that can happen. There are some times that people, they are on hospice, there may be some other kind of situation come up that hospice doesn't cover, and then that's when your B could cover it as well as your supplemental plan. So hopefully that made sense. It just depends on what you're having done. So can insurance companies lose money on supplemental plans? Can they lose money, or are they simply handling the administrative portion for Medigap plans and are made whole by the government? No, the MedSup plans are not made whole by the government at all. So MedSup plans are very much like your homeowner's insurance or your automobile insurance. They have actuaries, mathematical people who do statistics to try to figure out in advance what will be their losses on those plans, and then they set their rates based upon them making some kind of a margin. But yeah, if they have more claims than premiums coming in, then the company certainly is going to lose some money. And then, just so you know, when they are losing money, they do have the right then to go to the state insurance commissioner and ask for a rate increase for everybody that's in that group. But they're not guaranteed to make any amount of money, and the government does not cover any of their losses. It's just, again, it's the capitalistic system. Actuaries deciding where they believe the claims are going to come in, and then they establish their profit margins based upon that. So they can lose money. All right, do you have to call every year to your insurance supplemental plan to roll it over, or does it naturally happen? No, Diane. One of the nice features of a supplemental plan is that they're automatically renewed. In other words, every time you make a premium, it renews for the next month. And so you never have to call and do anything. That insurance company automatically renews it. In fact, they can never cancel it unless you pay for your premium. So that's why we like supplemental plans, because they truly are lifetime plans, can never be canceled by the insurance company other than non-payment of premium. All right, Ray said, I now heard that UnitedHealthcare often does not reimburse you. Should I change my plan? Okay, Ray, I'm honestly not sure what you're referring to there. So maybe you could reword that question. Because as far as us, we are certainly paid a commission by UnitedHealthcare or Aetna. So when you say me, we're paid the same. So I have no problem with UnitedHealthcare in that regard. In fact, I think UnitedHealthcare is, as far as supplemental plans go, they're very rate stable. We're brokers. We write for them, but we write for a host of other companies. So what we look for is stability of the rates. So if you're with them, I would see no reason in changing whatsoever. All right. So, and if I misunderstood your question, just write in again. Let me know. How about your medicine insurance? Does it roll over, or do you have to call? Okay, here's the way that works. Part D plans are only 1 calendar year at a time. And so in order for someone to change a Part D plan, the government gives us 1 time a year to do that. We just finished that time this year, October 15th to December 7th. And so what happens is every year during this October 15th, December 7th date, if someone needs to get a different plan because their plan was dropped or it's no longer covering all the medications, then they make a decision between October 15th to December 7th, and then the new plan they selected will go into effect January 1. So they're not like supplemental plans. They're only written for 1 year at a time, subject to change annually, no underwriting, of course, so you can pick a new plan if you need to for the following year. All right, I have a Plan G. Can I have a consultation with 2 surgeons for same reason and both appointments be covered? Yes. My understanding is that Medicare will allow a second opinion, and they will cover that. So therefore, if Medicare covers that, the supplemental plan has to as well. So again, I would make sure that you talk to those surgeons, and as long as Medicare covers, I promise you your G plan will pay their part as well. All right, hi, I'm from Florida. I'm on United Healthcare Plan G. As the new year starts, do we pay the Part B deductible the day we see the doctor, or does the doctor turn your paperwork into Medicare? Okay, yes, yeah. You would not pay anything out of pocket if you're on a Plan G when you went to a provider. What happens is that doctor is actually going to bill Medicare, and Medicare knows you have a Plan G, so they're going to take the balance of that, and they're going to actually send that to your supplemental company here, United Healthcare. And then if you haven't yet met your B deductible, then United Healthcare then will let you know that you're going to owe the doctor $50 or $100 or whatever that is. Now, United Healthcare also has something very unique, and that is called I think they call it Easy Pay, and it's a way that you can actually enroll into this system of theirs that will actually, they'll do a bank draft for your Part B deductible. So let's say you go to the doctor and the bill's $80 and you are responsible for that. They just actually would do a bank draft of $80. So they'll keep track of that B deductible for you. And once you've met the $257 for the year, then you'd be done. And so they make it very, very easy for you. They're the only company that offers that right now. And if you don't want them to do that, then you'll just get a bill from them and from the doctor, and then you can pay that direct. All right, ARP and others seems to recommend United for Sarasota. Okay, do you compare other major providers to United from? Yes, we do. William, just call in. We're brokers for multiple carriers, so we'll look at your zip code and we'll look at the companies in that area. We'll give you different premiums, and we'll also discuss the stability of the rates in your area by each of the carriers. So yeah, call in, and happy to do that for you. We provide that service. All right, Lone Oak, I turned 65 April 2025. How soon can I call you to get a supplemental coverage? Right now, you're fine to do that. And if you want to do it right after the 1st of January, that's fine as well. But some states we can write supplemental plans about 3 months in advance. Most states it's 6 months in advance. So you're in that time frame right now. Go ahead and just call in and set up an appointment, and we'll let you know exactly what you need to do. But yeah, you're ready to go. Okay, Brent, does the Part D 2000 cap apply to meds that are not on my formulary? It does not. So I wish I would have clarified that, but yeah, the $2,000 cap are only meds that are covered by the plan, or the 2K max applicable to all meds, even those not, yeah. So again, it has to be covered by the plan, and if it's not, then it would not be capped at the 2,000. Good question, Brent. Sorry about that. All right, Tamara, I'm in original Medicare. My premium will go up with my supplemental plan next year. If I end up moving out of state and the premium is different in the state, is the change right away? Yes, it is. Yeah, so what happens is once you have relocated and you've done a change of address, then the Postal Service actually notifies Medicare, which will then, of course, also notify your supplemental plan. And so the supplemental company does have the right to adjust your supplemental rate. Sometimes it goes up, and I've seen it go down as well. So that will happen for sure. And again, I've had people move, all of my career, and I've never had anyone have to cancel a plan because there was some, major price increase to their supplemental plan. Usually it's just modest increases. All right, Vicki, I'm a client. Healthcare.gov keeps telling me I need to pick a plan, but I went through Medicare school age and all my Medicare taken care of. Do I need to do anything else? Okay, well, Vicki, if you went through us, then everything was handled. And so, if you would like to, Vicki, if you're concerned about it, just call in. Our switchboard is still open for another hour and a half or so, and you can ask to speak to what we call the Tier 2 agent. Then go in, they can verify that everything has gone through. But just because the healthcare.gov does not show everything yet, I'm not shocked by that. That's not surprising because it usually takes those systems about 60 days before they're totally up to date. But if we took care of it for you, we did all the enrollments and all that was confirmed by our agent, then all should be well. But again, if you're losing some sleep over and don't do that, call in 800-864-8890, 800-864-8890, and ask to speak to a Tier 2 agent, and then go in and confirm all that for you. All right. Okay, Benny, when should I submit SSA 44 as I am now retired and begin Medicare in March? Thank you. Okay, well, as long as, Benny, if you're going to start in March, if you've gotten your letter where they're saying you do have an IRMA, then it's fine to appeal, but you have to have that letter. So if you have the letter in hand where they say you're going to have to pay an extra amount, then let's see, you begin Medicare in March. So you can actually submit that really within 60 to 90 days prior to starting your Medicare. So you're fine to do that. In fact, the letter you got will say they like to hear from you within 10 days of receipt of the letter. All right. And now keep this in mind. If that life-changing event has not occurred, they're not going to approve your appeal, your reconsideration. And so just make sure that life-changing event has happened, between now and the last 2 years. In other words, you can't say, well, I'm going to retire in March. They're not going to approve that because you may change their mind. You may change your mind. So they will not approve it if that life-changing event has a future date. But if it has a previous date of up to 2 years, then you can go and apply right now. It's fine to do so. Okay, how can you make... Okay, very good. Okay, let me just give you the numbers. I don't have all that memorized yet for 20, but I have them with me. Okay, so here's the way it's going to work. From the time you're 62 when you're first eligible for Social Security, up until December of the year before you hit your full retirement age. Okay, so again, from 62 up until December before you hit your full retirement age year, you can make this year you can make $23,400. Okay, and then the year that you actually turn full retirement age, again, you're not yet full retirement age, but the year that you turn full retirement age for 2025, that number went to $62,160 for the year, and it's not prorated; it's an annual amount. And then once you hit full retirement age, then you can make as much as you want. So let me give you the numbers again. The low amount was $23,400. That's 62 up through December before you hit full retirement age year. And then full retirement age year at $62,160. All right. In fact, let's say someone were to hit full retirement age in March. That means they could have made $62,160 for January and February because, again, it's an annual amount. All right. Hope that helps. Let's keep going. Will IRMA apply your salary from 2 years ago even if you were let go at work at 67 in January of 2024? Okay, so if you're starting 2025, they're looking back at 2023. And so, yes, they're going to look at 2023 even if they let go of you in January. But here's the thing. If you were let go in January of 2024, then you can appeal your IRMA for this year. You would just put down your work stoppage of 1 of 2024, and they won't hold 2023 against you. So again, you're going to fill out the form SS-44, and you're going to check the box that say work reduction or work stoppage, and then put in your number of 2024. You can even project for 2025, and they will base your Part B premium on those numbers instead of 2023. So your answer was yes, but appeal that for sure. Mark, you should be fine. All right, I'm 66 years old and still working, have company insurance. Do I have to sign up for Medicare? And the answer is no, you don't. As long as, Jerry, there are 20 employees on the payroll or more, you don't have to sign up for A or B, either one. Now, I would suggest if you don't have a health savings account that you're contributing to, I would go ahead and sign up for Medicare A only. It's going to be at no cost to you. And so I'd go ahead and sign up. It's not going to pay first, it pays second. Your company plan still pays first, but Medicare A could pay some co-insurance if you were hospitalized. So I think it's fine to have A only, but I wouldn't have A or B if I have an HSA. I'd keep contributing to the HSA instead of having any form of Medicare. All right, next question. Can I change my Medicare Advantage plan during the January-March timeframe? Yes. Yeah, Lori, as long as you are on an Advantage plan January 1, then you're eligible the first 3 months of the year to one time during the 3 months switch to a different Advantage plan or even a different Advantage company. You make that election one time. It's called an OEP, open enrollment period. And so if you make the change in January, your new Advantage would start February. Make the change in February, new Advantage starts in March. And of course, March would start in April. All right, so yes, you can do that. All righty, Regina, can you change between supplemental plans between one sub G to another supplemental plan G? Well, Regina, in the majority of states, the answer to that would be yes, but you have to medically qualify to do that. To move G to G or even G to an N, most states, after 6 months of your Medicare B date to switch your supplemental plan, you have to medically qualify to make that switch. Now, there are some exceptions to that. And again, this is going to be off memory, but there are some states that are called birthday rule states. And we'll just start in the West Coast and we'll go towards the East. California, Oregon, Washington is all year long, but same concept, but it's all year long. Again, California, Oregon, Washington, the state of Idaho, Nevada, Oklahoma, Louisiana, Missouri, it's called anniversary, but the same concept, anniversary rule, Illinois, Kentucky, and Maryland. Those are called birthday rule states. Missouri's anniversary, but it just simply means this, that around your birthday, and again, this varies from state to state. Some states it's 30 days before your birthday, 30 days after. Some states it's from your birthday for the next 60 days. Some it's your birthday for the next 90 days. But they have this rule that says you can move from a G plan to a G plan or a G plan to an N plan. It's like to like or like to less. Without any medical underwriting during that period of time. Okay. Now you can switch a supplemental plan anytime you want to, but you have to go through medical underwriting. So these states that have these birthday rules, that's the exception. If you live in one of those states, then you can make the switch, no underwriting required. Okay. So it just depends on where you live. Call in and we'll tell you exactly the rules in that particular state. Happy to do that. All righty, Barbara, my husband signed up for Medicare D during open enrollment, but it has been 4 months since getting Medicare. Why is he going to be charged a penalty since he signed up during open enrollment? Well, here's why. Because a person is eligible for a Part D plan once they're 65. And so if they don't take a Part D plan within 3 months of turning 65, and they want to pick up a Part D plan after that, then they're subject to a penalty. Now, you will not have to pay a penalty if you had a coverage at work or had coverage through a VA. So if you're getting a letter that's saying you're going to be penalized, it's either because you didn't have coverage or you had coverage, but they're not aware of it. And so if they're not aware of it, then you want to respond to that letter. It's called an LEP, Late Enrollment Penalty Letter. Respond to that and let them know that you had prior credible coverage, either through a group plan, a union plan, the VA. But if you did not have that credible coverage and you did not have a drug plan, you're still going to be subject to penalty, even though you decided to take one during the open enrollment season. That has nothing to do with it. The open enrollment season just says you can have a drug plan during this period of time, enroll in that plan, then it's time for you to do that. But you can still be penalized. All right, Michelle, what plan is suited for me when you don't have any health problems? I maybe want to check yearly checkup. Well, Michelle, it just depends. Yeah, you don't have a health problem right now, but that could change in 3 months or 6 months. So if you're asking me that what's the cheapest plan available because you're healthy, then you'd want to go with an Advantage plan. For sure, because most of those have zero premium. You still got to pay Medicare, but you don't have to pay the plan. So if you're looking for the cheapest coverage and you think you're going to remain healthy, then get Advantage. But listen, anytime someone gets sick, Advantage is not going to be the cheapest. You're going to spend more money out of pocket if you had cancer on your Advantage plan than you ever would on your supplemental plan for premium. So again, if we're talking just monthly budget, cheaper, that's Advantage. If you're looking at overall cost, if you have a health problem, then your supplemental plan is almost always going to be your better value. All right, can I have FHB plan and a supplemental plan? Well, I would not recommend that, Bob. If you want a supplemental plan, what happens is you actually have to terminate your FHB insurance, and you got to fill out a form to do that. So I would not have FHB plus a supplemental plan because that's not possible. And so what you really have to decide, Bob, is this: if you truly want a supplemental plan, then what you must conclude then is that your supplemental plan is then a better value than your FEHB insurance. Because again, if you have a SUP, you got to terminate your FEHB, and that's lifetime termination. Now, what a lot of FEHB people do is if they don't want to pay their premium for FEHB and they don't want to terminate, they will actually just suspend FEHB and then get an Advantage plan. And then if they're unhappy with that, anytime they can go back to FEHB. So when we take an Advantage, it's only a suspension. When we do a supplemental plan, it's a termination. And again, it really all boils down, Bob, to what's it cost you to be on the FEHB plan. We're finding more and more times now they're not a very good value, so people just terminate them and just go on traditional Medicare and get a supplemental plan. And if that makes more financial sense, then it's a fine move to make. All right, have Plan G with Blue Cross Blue Shield, but moved to Florida. Was told that I can keep the plan, although I no longer live. That's true. Should I check in the Florida area to see if there's a better plan with lower premiums? Okay, Lee, you can do that for sure. Now, when you get to Florida, though, you're going to have to switch to a different carrier. You're going to have to medically qualify to do that. And so, yeah, I would definitely look at the rates. In fact, we write them in both states. So happy to tell you what your rates would be in Florida once you've got there. And again, if it makes sense to reapply, if you can go through medical underwriting, then I would do that. If not, it is true. You can keep your Blue Cross Blue Shield Illinois plan. Once you get to Florida, they can change the rate, and they probably will change the rate. And so as long as that rate is still very comfortable for your budget and comparable, then keep the plan. But it doesn't hurt to check, and we can tell you what the current rates are in Florida. All right, let's keep going. Doug, applied for a plan in. Medical questions were required. They deducted my first month's premium after a few weeks. Does that mean I'm approved? Well, Doug, it sure should be. Usually a carrier is not going to do that first bank draft deduction unless they've approved the policy. So what happened is it went through underwriting, you got approved, and so then it went to the policy issue team. And again, in order for them to lock that rate in for a year and to issue the policy, they had you pay your first month's premium. So you should be set and good, and soon should get your new cards for the supplemental plan as well as your policy mailed to you. So you should be really fine. All right, Shannon, I turn 65 next year, but will stay on my own company plan. What do I need to do for all the various parts of Medicare? Well, Shannon, if you are working for a company that has 20 employees or more on the payroll, you don't have to do A or you don't have to do B, neither one. Now, if your employer has 19 people on the payroll or less, you have to enroll in A and B. But again, it's the size of the payroll that determines what you have to do. So I'm assuming, like most people, you work for a large employer, 20 or more, so you don't have to do anything at all, A or B. However, as long as you don't have an HSA, a health savings account that you're contributing to, then I would encourage you to enroll into A only, for sure. Take A only. There's no premium for that, and that way A may pay something if you're hospitalized. But I also would tell you, Shannon, I would make a comparison between your group plan and your Medicare option. Because we see this all the time. People's their group plans are kind of mediocre, very expensive, high deductibles, high premium, and you can go on Medicare while you're still working, just say no to the group plan and say yes to Medicare. And if that makes financial sense, I'd recommend doing that. Call in and we can help you make that comparison to see whether it's not in your best interest to go on Medicare or stay on the group plan. All right. All right. Okay, Kathy and Frank. Well, first off, I'm not an accountant, okay? I am a licensed fiduciary investment advisor, so I'm very familiar with what you're talking about here, but I think it would still be good to talk to your accountant. But depending upon sell your residence. There are some exemptions that are allowed for sure, that money could not be subject to tax. But if it is subject to tax, then that is certainly going to be then calculated in your IRMA. But again, if it was money that you didn't have to pay taxes on because of that, because it was a residence, then you should not have to worry about that. But again, ask your accountant for sure. I don't know enough to tell you exactly how long you've been in the home. I know you got to be in the home for at least 2 years or the last 5, and there's some rules. So as long as you fall within those rules and you didn't make more than $500,000 profit on that property, then that money should not be counted against you. Okay, let's keep going. I am 62. I've been okayed for disability. Do I need to apply for Medicare? No. As long as you're telling me you're okayed for Social Security disability, then you don't have to do anything with Medicare. So what's going to happen, unless you have a certain disease, the majority of people that are approved for Social Security disability, their Medicare A and B starts on the 25th month of having received Social Security disability payments. Okay. Now, there are exceptions. There are certain diseases where you actually start that Medicare earlier. But if it's just normal disability, 25th month, you will be enrolled in Medicare A and B. Do you write plans for Arizona? Yes. In fact, that's one of our top 5 states, TK. So write them all the time throughout the state of Arizona. So if you need some help there, please give us a call and you talk to one of our agents, and we'll tell you about the market there and stability and different options that you have. All right, I will pay a penalty if I change from Advantage Plan to Supplemental Plan during open enrollment a few years later. No, there's no penalty at all to do that. The only thing you have to be concerned about, if you're on Advantage and you move to Supplemental Plan, in all but New York, Connecticut, Vermont, Maine, and Massachusetts, you have to medically qualify to make that move. So you're not penalized in making the move, but you're not guaranteed to get a Supplemental Plan because you have to go through underwriting. So as long as you're generally healthy, you should be able to do that. But there's no penalty at all for making that switch, I promise you. The only penalty would be if you can't get approved, then you have to stay on your Advantage. All right, what are your thoughts on dental and vision plans? We currently have no dental or vision problems. Well, Gary, I can tell you from stats in our own company, we're about 50-50. Half of people get dental plans, half don't. And so really it just depends on your oral health. If you have, only thing you do is get maybe cleanings once a year, twice a year, whatever, then you are probably not going to get your money back out of a dental plan. I'm personally on one. I like them. Of course, I have my kids on them as well, and so I think they're fine. I would tell you that the majority of them are going to have some kind of a limit. They're going to pay anywhere from about $2,000 to $3,000 a year plus cleanings. You're going to pay on the average about $50 a month. So you're going to spend about $600 a year. And if you only do cleanings and have great teeth, you're probably not going to get your money back out of it. If you have problems, root canal extractions, crowns, those kind of things, then they'll probably pay for themselves. Now, as far as vision plans go, number one, vision plans are very low cost. iMed plans about $10 or $12 a month. VSP is going to be about $16 to $18 a month. And so when it comes to vision, if you have a supplemental plan, remember Medicare and your supplemental plan are going to cover almost everything vision anyways. All the big stuff, cataract surgery, glaucoma issues, macular degeneration, wet or dry form, all those things are going to be covered by Medicare and your supplemental plan. So vision plans, really what they're going to do, they'll give you one eye exam a year and they'll give you some credit towards eyewear. So again, if you get new glasses every year or two, probably would pay for itself. If you don't, I wouldn't have a vision plan because again, Medicare and your supplemental plan are going to cover you very, very well. Okay, what if my drug is not in the formulary in Part D? It's still covered under the 2000. Okay, I'm sorry. Yeah, no, the 2000 cap applies to only formulary medications. That's it. Okay, so nothing outside of that would be part of the $2,000 cap for sure. Okay, are they paying for weight loss? Okay, not yet. I know there's talk of that, about making that become part of the Medicare coverage, but my understanding is that's not finalized yet. That's just proposed legislation. I know you're talking about Ozempic, some of those meds that would be treated for diabetes. Also, people are taking for weight loss. So if it's a medical condition, then yes, it's covered. And of course, the benefit would be weight loss as well. But if it's prescribed for weight loss only at the present time, those are not being covered. That could change. We'll just have to see. Okay, Juliet, are hearing aids covered by anything? Yes. The majority of Advantage plans are going to have some kind of a hearing aid benefit built within their plan. Now, they're not going to be free. What happens is the plan is going to cover hearing aids one of two ways. They're either going to say we cover certain hearing aids at a certain network, and you'll have a copay depending upon the quality of the hearing aid, or some plans will just give you an allowance. They'll say we'll cover hearing aids up to $1,000 per year per ear, or $1,500 per year per ear. So they'll set a budget for you, or they'll set up a covered hearing aids plus a network, and then you'll have a copay. So again, that's the only thing that's going to cover. Original Medicare is not going to, supplemental plans is not going to. Only Advantage plans will have some type of coverage. All right, looking at Advantage plan with premiums of $166 with MOOP of $1,500 in and out network, which is less as many plans with no premiums. Okay, we move on me. Okay, well, the first thing I'm looking at here, Mary, I'm assuming that this premium 166, it must be what's called a waiver plan. This means that this is an employer-provided Medicare Advantage plan. Yeah, because there's no traditional market plans that are going to have that I've ever seen. And so I think what you have to decide, Mary, yes, I like the $1,500, but keep this in mind. If you have a $166 a month premium, you're also enrolled in Medicare B. What I would do, I would look at my premiums on an N plan, probably going to be less than that, and your max out of pocket then would only be your deductible of $257 and excess charge if it occurred. So I think you're going to be a lot better off with an N plan. If you take that company Advantage plan, you're still going to have networks to deal with. Again, I like the MOOP, but I think you can get a lower max out of pocket with a supplemental plan N. Certainly supplemental plan G, and not have to pay any more premium. And then you'll have to deal with networks. And also, Mary, if you take that waiver plan and get off of it, you're still going to have to medically qualify to get off of it in the future. So again, I think that's a little pricey for an Advantage plan, in my opinion. All right, I thought Medicare enrollment due date was December 7th. You still have time to enroll until December 15th. Okay, yeah, Michelle, that December 7th date was only for people that are already enrolled into Medicare, already that had either Advantage plans or drug plans. That's the only people that the December 7th timeline applies to. If you're on an Advantage plan or a drug plan, then you had up to December 7th to change that. And then after the first of the year, if you're on an Advantage plan, you have another 3 months to do that. So again, Michelle, I'm not sure when your birth date is. I'm not sure if you're talking about new to Medicare. I don't know enough to really answer the question, but I know nothing about a December 15th date. That's nothing I'd be aware of at all. Okay, let's keep going. All right. Someone who was in original Medicare enrollment in MAPD can drop the plan in OEP. Someone originally and enrolled in an MAPD can. Okay, and that is true. So, Lillian, what you're saying is that you had Medicare A and B, and you chose to be covered by an Advantage plan. And so, if that's what you're saying, then yes, if you own an Advantage plan on January 1, then you have the first 3 months to make a switch. You can go back to original Medicare, get a supplemental plan, or you can switch Advantage plans during that OEP one time during the 3 months.
Okay.
Any more questions?
They're coming through.
I know there's a little lag here, folks, as questions come through. We'll answer them. We're fine to do so.
Do you want to comment on the UHC stuff at all?
Okay, and tell me more. What do you say?
Concerns based on that.
Oh, you mean what's happened with this gentleman? Okay,
Yeah,
yes.
There's a lot of talk about it. People are worrying, should I leave my plan?
Okay, let me share this with you. I mean, of course, everyone was just sickened by what happened to Mr. Thompson with UHC. But if you're with United Healthcare and you're enrolled in A and B and you have a supplemental plan, I would not be switching that plan. I just would not be. Now, if your rate has gone up a lot and you want to shop to make sure you're still competitive, then call us and let's make sure of that. But what happened in his situation would not be a reflection at all, in my opinion, when it comes to your supplemental plan. Now, I would tell you that one of the issues that's very sad in the industry with it when it comes to Advantage plans, and it's not just United Healthcare, it's all the companies, will sometimes delay or deny, and that's this whole issue. They just, have pre-authorization right. And that's one of the things that we've been saying for years with Advantage plans. You've got to live with the consequences of pre-authorizations. And folks, frankly, the majority of things get approved, but some of them don't. In other words, if they're not convinced that you really need that knee replacement or hip replacement or that extended skilled nursing stay, they're not going to approve it. And sad to say, when you take an Advantage plan, you have put yourself in a position where the insurance company has the final say-so. That's why I don't like them. I told you why I like Advantage plans. If you cannot afford a supplemental plan, then you ought to get an Advantage plan. But if you can afford a little extra every month out of pocket on your monthly budget, then get a supplemental plan. It's high quality coverage, plus there's no hassles dealing with the insurance company. Insurance company has no say-so at all. If Medicare covers, that supplemental plan has to cover as well. That's why they're wonderful. Folks, we get no complaints on supplemental plans, ever, at all. Advantage plans is where all the complaints come because pre-authorizations and because of networks and because if your health changed, you can't get off of them. Okay, I turned 70 in January. Started on Social Security. I'm still working. Health insurance with a large company, 65, I got Medicare only when I started taking Social Security. Okay, no. Now, what's going to happen, Amic, what you do whenever you, if you've notified them that you're going to turn your Social Security on, obviously you have because you're in January, you turned 70. So they would have asked you if you wanted Medicare Part B. And you, of course, should have said no to that. If they didn't ask you and they enroll you in a Medicare B and your Medicare card shows up, all you have to do is return it to them. You have to sign on the back saying you don't want Part B. You can also fill out a form called a 1763, and you can disenroll from B. So as long as the group plan is good at work, it's competitively priced, then you can still get by with A only, even though you're on Social Security. But again, you got to drop the B. And hopefully they would have ask you that whenever you applied for your Social Security. But if not, you can still undo the B, no problem. Form 1763 or mail the card back in when it comes. Okay, turn 65 in June, then don't have until March 25 to join. So let's just back up the clock. If you turn 65 June, back it up May, April, March. So really, anytime after March 1, you can enroll into Medicare A and B. It's 90 days prior. Okay. And if I have several medical issues, I'm told that I should enroll in Medicare and not an Advantage plan. Is that correct? It is. If I had some health problems, and let me say this, folks, I have no health problems, okay, at all. I don't take any medications. I'll be 64 in January. If I stay this way, I'm still going to get a supplemental plan. Why? Because things can change, and I can afford a monthly premium on a supplemental plan. That's what I'm going to do. Okay, so to answer your question, you have health issues. I definitely would take original Medicare. Why? Because you'll have very little out of pocket if you have a G or an M plan. You don't have to worry about max out of pockets like Advantage. And if you have real serious health issues, especially if they're chronic, then you may never get a chance to get a supplemental plan beyond the first 6 months of your B date. So to me, really, it is a no-brainer. Get that supplemental plan. You're going to be happy with the coverage. You're going to be very happy with the network because you can go anywhere you want. It's a permanent plan, so there's so many wonderful benefits to supplemental plans. All right. Are you saying that even if Medicare approves it, an Advantage plan may refuse, deny treatment? Absolutely, I'm saying that. Now, I am saying this, the majority of the time they are going to approve them. But last year, because we don't have the stats yet for 2024, but last year, 2023, there were 4 million people that were denied medical services because of prior authorizations. 4 million people. Now, again, there's 35 million people that are on Advantage plans. So the majority did not have the issue. But if you're one of the 4 million, it's very frustrating. Hey, I've had clients before that needed a knee replacement. Advantage plan wouldn't approve it. They said, no, we want you to go to therapy for 9 months. So then they'd revisit it. I've had people, a couple occasions, that needed full hip replacements. The company said, no, we're not going to pay for that. We think you need a rod, and that's all. We're not going to pay for a full hip. I've had several clients, and this is a sad one, be in a skilled nursing facility. And the algorithm, the computer system of the Advantage company said, you're in this condition, you're in skilled nursing, we're going to cover you for 18 days, or we're going to cover you for 15 days, and that's it. Whether clinically you need to stay or not, doesn't matter. They're not going to pay beyond that. And so those are the problems that you deal with in this whole pre-authorization process, right? And so it can happen. And never will it happen on a supplemental plan, because it can't. If Medicare says they'll cover it, doctor says you need it, end of story. The supplemental company has no say-so whatsoever. They'll never interfere. They can never delay. They can never deny whatsoever. They have to cover if Medicare covers. Okay, on job plan, like it, good. How soon after I give it up do I have to sign up for A, B, G, etc.? On Social Security, how do I turn down Medicare? Okay, let's go back and let's answer the first one. So first off, sir, what you have to do is once you are ready to retire, let's say you tell me, hey Marvin, I'm going to retire. My last day at work is June 30th, and I'm retired July 1. Then immediately you need to go on Medicare A and B, because any plan you would have from the work, be it COBRA or whatever, is going to be in the second payer position. So once we're no longer working and we're 65 and beyond, you have to go on Medicare A and B. Now, if you're offered COBRA as part of the severance package, you can keep it. I keep it no more than 6 months. That's it. Now, if you have spouse or children on it, you can keep it longer for them. But for you, you only can be on that COBRA for 6 months, because after that, you've lost your right to get a supplemental plan. So again, be very careful with COBRA once you're on Medicare. But you have to put Medicare in the first payer position once you're no longer working after 65. So that's that question. Number 2, you're on Social Security. How do I turn down Medicare in May? All right, so what's going to happen is they're going to mail you your card. You're going to get it 100 days prior. And so the way to turn it down is when you get your card, just turn it over. And on the back, there's going to be a little box back there, and it's going to say, there's going to be an option. It's going to say, I do not want medical insurance. Medical means Part B. Hospital is A, medical is B. So you'll check the box saying, I do not want medical Part B. You're going to sign your name, and you're going to mail the card back into Medicare, and they'll drop off the B, and they'll send you back a new card that'll say Medicare A only. Okay, so that's the easiest way. Now, another way you can drop B is by filling out a form called the 1763. Again, it's a very simple form, and you can fill that out, dropping Part B, and you explain when the comments section, you're dropping B because you're still covered by a group plan, and the same thing's going to happen. Then they'll send you back a new card that'll say Medicare Part A only, and then once you get ready to retire, lose the group plan, then you can go on Part B using the SEP. All right? And keep contributing to that HSA. I think those are wonderful to have. And just remember, though, when it comes to HSAs, if you keep working and you're after 65, once you enroll into Medicare Part A, they always backdate your A date 6 months. 6 months. Now, they'll never backdate it prior to 65, but they'll backdate it 6 months. So if you start enroll into Medicare at 67, they're going to backdate your A date 6 months. And so from that A date, you should no longer be putting in new money into the HSA. Confusing, but that's the rules. I didn't make them. I just have to be the messenger. Any more? All right. Can I buy a plan without Medicare? I'm 68, not qualified for Social Security. Only have 35 quarters. I'm in Florida. Okay. Well, no, you can't. Because in order to have a supplemental plan, you have to have A and B, and to have an Advantage plan, you also have to have A and B. Okay, so the next question would be, not qualified, so are you married, or were you ever married in the past? Because if you're presently married and been married for a year, you can draw your 40 quarters from that spouse as long as they're 62 and have their own 40 quarters. Or if you're married in the past, as long as you're married 10 years or longer and didn't remarry prior to the age of 60, you can draw your quarters from an ex-spouse as well. So there's some rules on that. So Angel, that's what I'd want to know. So you don't have your own 40. And the other thing you could do, if possible, Angel, I'd try to go back to work. You only have to work, let's see, the quarter this year is $1,810. So you multiply that times 4. That is, $7,240. And you can pick up 4 quarters in 2025. That's all. And then you only need 1 quarter. So right now the quarter is monthly $1,730. So boy, if there's any way you can find work it's net self-employment income or W-2 income. Maybe a family member has a job for you or something where you can go to work for them and to get those quarters, and that way you can have Part A 0 for the rest of your life and get supplemental plans and advantage plans. All right, mom lives in one of these states, Connecticut. Okay, got it. Always paid A and B Medigap and Part D. Can she change Medigap plans anytime she wants, up or down? 3 premium plans are available, each with increasing. Okay, very good. Okay, yes. In those, now let's clarify this. The answer to your question, New York, is a yes. Massachusetts would be a yes. And I think Connecticut as well. I think Maine only has 1 or 2 months a year that you can do that, and that's for a Plan A only. But your Connecticut, your Massachusetts, and your New York, yes, you can have those. There's no underwriting for supplemental plans at any time in those particular states. So she should be able to do that. Now, if we're talking about Massachusetts, that's a waiver state. They're like Wisconsin and Minnesota. They have their own supplemental plan system. Now, they have lookalikes for sure, like G and N, but again, they do have their different rules. But again, what you're saying there, yes, she does have some options. And by the way, whoever this is, call us. We write in all those states. So just call in, 800-864-8890, or you can see the one on your screen. Call in and tell the agent your situation with your mom, and we'll help you. No problem at all. All right, I had 2 months of supplemental plan, then changed to Advantage for 4 months. Okay, in January I will go on my wife's work plan. Can I go to supplemental plan in the future? Okay, okay, so, and then change to Advantage. Okay, so I guess what you're saying is you're going to drop your wife's Advantage plan, and you're going to be covered by a group plan. Okay, so the answer to your question is yes. You'll be able to do that. You come off an employer plan, and that would be a guaranteed issue. So that is possible. Now, Ollie, what I would recommend doing, if you're going to be covered by your wife's plan, smartest thing to do is drop your Part B. Just have A only. So if she's going to cover you and she's planning on working for a while, drop the Part B. Why pay the Part B premium? Because her group plan is going to be the first payer anyways. So now all of a sudden you're paying $185 a month for Medicare to be in the second payer position. So what I would do, I'd fill out the Form 1763 and drop your Part B and have A only. And then for sure it's easy when you pick up B when she decides to retire, no questions asked, because they're going to give you a brand new B date, and then you'll be able to get any supplemental plan that you want, not just a guaranteed issue product. So that's what I personally would do. It's a waste of money. If her employer is 20 or more, you can drop Part B. All right, you said to turn the card over to turn down B. Will that also turn down A? No. The only people that can disenroll from Part A are those that have to buy Part A. If Part A is free and you have started it, it's gone into effect, you cannot disenroll from A, and frankly, you wouldn't want to anyways, unless, of course, you have an HSA. Now, if you have an HSA and A has not gone into effect yet, yes, you can then ask them to cancel the A. But once A has gone into effect, it cannot be canceled unless you're buying it, which is only 1% of the population. Most people, A is free. All right, do I need to talk to you guys now about Medicare turn 65 in June, or wait till January 1? Yeah, enjoy Christmas. Yeah, I would, call in and set an appointment up for something after January 1. And by the way, we're open. We're closed, a couple days around Christmas, but we're happy to talk to you. But if you don't hassle with it, it's not like you're still early in the game if we talk to you in January for sure. But call in, set an appointment up, and we'll take good care of you, and we'll look forward to the opportunity to be able to serve you. All right, any more? All right, I think we're going to call it quits for tonight. By the way, thanks so much. If we can help, our switchboard is still open until 7 o'clock Central Time. Call in, and we'd be delighted to help you. And folks, keep this in mind. Whatever you need, any service you need, whether that's help with enrolling in A and B, appealing IRMAs, all these details I talked about. All of our agents have been trained by me. They know this business well, and we'd be delighted. And there's no cost at all for our services, folks. We truly are totally free to you. Totally free, because the insurance company always pays us, not you, at all. So we'd be delighted to serve as your Medicare broker. We'll plan on seeing you either Monday at the Medicare Monday event, or again, we'll let you know about some more of the Thursday events here over the next few weeks. Take care.